Hi, everyone. How are you? Can everyone hear me okay? Oh, I better look at the chat here. Chat. Can you guys hear me? All right. Looks like the mic is working. Sweet. Thank you guys so much. I just want to say that I am having a day today. So I really appreciate all of you being here. I had this, well, I woke up under the weather, so my voice is a little tenuous and I might cough a little bit, but I don't think I'm contagious. And then I had this meeting with Katie, one of our PAs at our Shea location, and it was early. And so right when I went to leave and go see research patients at Thompson Peak, um, my car wouldn't start. So my battery is dead. And I swear I had jumper cables, but apparently I don't have jumper cables. And so it's just been one thing after another. And so thank you to Johanna for chauffeuring me around because now I'm at PV. So I'm officially have been to all three locations with no car today. I forgot my makeup in the car. So I'm just kind of crazy today, but I wanted to really show up for you, and I'm so excited about talking about these technologies today. And I'm hoping some of you are planning to treat yourself for the holidays. So I definitely didn't want to reschedule this webinar. I wanted to be here for you. And now that I finally made it here 1 minute ago, I'm so glad that I'm here. So thank you for you being here. Okay, so we're going to talk about gentle yet powerful ways to stimulate your skin, to provide rejuvenation, and to provide some lifting. So what are we talking about here? We're talking about our texture. We're talking about the glow of our skin. We're talking about pore size. We're talking about brown spots, and we're talking about lifting. So these things, or a combination of them, will do all of these things. All of it will give us all of these results. So we're going to start with this peel. It's called the PRX, and instead of a peel, they call it a biostimulator. We also often call it the party peel in our office. Why? Because you actually get very little to no peeling, and your skin immediately looks tighter afterwards. So you get this little 2-week honeymoon phase where your skin looks super tight and super lifted, super glowy. And then it loosens up a little bit. And then your collagen starts to develop and grow over the next 6 months. And by the way, anytime we are talking about collagen, producing new collagen, which is really what we're doing today, right? Like all of these things produce more collagen, which gives us the results that I just mentioned. So anytime we talk about new collagen, we are talking about a 6-month process. So the treatment day is day 1. And then over the next 6 months, you are going to see a very gradual change. And that's one of the reasons why we do before and after pictures, is so that you can see how far you've come, because oftentimes you're just looking a little bit better and better each day after that initial honeymoon phase. So going back to this PRX biostimulator. So this is completely non-invasive. So those of you who are a little scared of needles, lasers, this is completely free of all that. So it's also fast, so we can get you in and out in a pretty decent amount of time. And it's less dependent on light. So we do care about the sunlight that you're getting, but we're a little less picky about it than a laser. So this is a peel that uses TCA, trichloroacetic acid, and hydrogen peroxide. So what they've done is combine these two things to make the TCA peel very TCA compound, which has been used in peels for decades. They've used it to reduce the downtime while still maintaining the effects. And it's also not painful, which is a little crazy. Back when I was a resident doctor, 2005 to 2008, I would often do plain old TCA peels on me up to 20%, and the 20% ones were really uncomfortable and they made me peel like a snake. So this is really nice to get something this powerful where you're actually experiencing very little to no peeling. The light exposure is not as important, and the pain is minimal. So what do we see? This is immediately going to tighten your skin. So it's going to kind of suction cup everything in, and it reduces the appearance of fine lines. And so you immediately look better. Like I said, you have this little 2-week honeymoon phase where everything's just super tight for 2 weeks and people are giving you compliments. You're feeling like $1,000,000 when you're out and about. And then things relax a little bit. You still see improvement, but things are a little bit more relaxed. And then you're getting that gradual long-term benefit. So this is going to also produce elastin in addition to collagen. Elastin is very important because it also keeps the skin looking very supple and youthful. And we talked about the lack of downtime. So here's someone getting a PRX peel, and you could see she doesn't look like she's in pain. It's simply this liquid that's applied to the face, and then it's massaged in by our esthetician. So our estheticians do this procedure, and it's very, very easy and straightforward, and they're experts in doing this. So this treatment takes about 20, maybe 30 minutes if your neck is included. And it's very easy. If I'm getting a lunch break, I try to talk one of the estheticians into treating me during my downtime because it's just very easy and you look great immediately afterwards. So this is Joe. He obviously is very young and has great skin, but he did these a series of peels, and you can see his skin is smoother. If you look at his forehead, there's less fine lines. Look how much tighter his cheeks look. And that's pretty good for someone in their young 20s. You have to really get a good result to make someone's skin look better in your young 20s because it's already so good. And then here's another example of someone after one treatment. You can see her skin just looks tighter. And the reason why we have this view is we're trying to capture the results in natural sunlight because you can already see the skin is tighter, rejuvenated. She looks less, tired. She just looks great. And that's how you look right after a treatment. You can go back to work. You can go to a social event. That's why we call it the party peel. Okay, so this is me getting a peel, and that's when my melasma was bad. So you can see this is immediately after one treatment, and I had the best results after I did a series of treatments. So usually you do a series of 4 or 5 treatments. If you're able to, you do it about a week apart, and then we also give you skincare that exfoliates and helps to enhance the peel's results. I've gotten absolutely great feedback on this peel, and I think you would really like it. It's a really great treatment for yourself, very easy to do. And sometimes if you don't have time to come in every week and do the series, I am a believer that you can also get great results coming in once a month or whatever works for your schedule. But it is nice to do that series of treatments because you will get better results the more treatments that you do. So stimulates collagen, very straightforward, is simply a liquid that's on your face, little to no downtime, minimal discomfort, if any, and the results are evident right away. So now let's move on to something I call an easy laser or a puppy dog laser. I'm talking about a patient experience. I'm not talking about results. So this is called a Clear and Brilliant. Some of you have attended my webinars where I've demonstrated and talked about Fraxel, this is exactly the same wavelength of the Fraxel. It's just like the puppy dog version of the Fraxel. So it's 1550 nanometer and 1927 nanometer laser. And what that means is it will still go into your skin and stimulate collagen and elastin, just like the Fraxel does, just very gentle. what does that mean for you as a patient? There's way less downtime and way less discomfort. So for the Clear and Brilliant, you can be in and out very quickly. Usually I recommend numbing. If you do have the time, I recommend numbing 30 to 45 minutes. But some people will even do it with very minimal numbing. I don't necessarily recommend that, especially your first time, but this is not something like the Fraxel where we're numbing you for like an hour and a half, et cetera. And you get we're going to demonstrate this. You get this treatment and it takes about 15, 20 minutes as well. Very, very easy as a patient. Someone like me with very fair skin would have about 1 day to 2 days, so 24 to 48 hours of just looking very mildly sunburned, very, very light pink. If someone has darker skin, there's usually no downtime because the red is not as evident. There are these little sandpapery things that you feel on your skin. And if you've ever had Fraxel, that's very obvious. You can kind of see them as well as feel them. You get that as well for this laser. However, it's usually something in my experience that other people don't notice. You notice it when you're washing your face. I find it kind of annoying when I'm washing my face. I know they're there. That persists for about a week. But in terms of downtime and experience, it's extremely easy as a patient. So what is this going to do for you? This is going to improve the appearance of your fine lines. Because of how much collagen is produced, this like produces a ton of collagen. It will help your pores. And so, of course, we've been talking about collagen, collagen, collagen. So it's going to do the collagen. It will also do elastin, by the way. Excuse me. So very little to no downtime. So this will improve texture, pore size. It will help with brown spots. It will be preventative. So if you want to slow down aging, this is a fantastic treatment for you. So when you produce collagen, it's going to keep everything tight in your skin, and it's going to keep your texture looking great, and it's going to keep your overall radiance increased. So I absolutely love this treatment. I just had a Fraxel treatment. Otherwise, I'm kind of talking myself into getting one of these treatments. But if you think about Clear and Brilliant versus Fraxel, I usually say, and this is unscientific, but I usually say in my experience, 3 or 4 Clear and Brilliants is equal to 1 Fraxel. So I do have patients who they don't want to do the Fraxel, so they do the Clear and Brilliant maybe once a quarter or twice or 3 times a year. We have patients who do a Clear and Brilliant every month. It's extremely customizable, and I would be very happy to help you come up with a plan based on your goals, budget, and skin type. And really, that's what we do when you come in for a consultation. We have to take all of these things into consideration. We have to take not only the health of your skin and your goals for it, what you want to improve, but also what your budget is. And then other considerations like your time, your pain tolerance, the amount of time you want to see results, etc. So we can help you with all of these things. I just want you to know there are things out there that are able to be extremely effective in this regard, and you have choices. Okay, so we already talked about this. You get basically a really exciting rejuvenation of your face caused by exfoliation. So there's these little teeny tiny little columns of skin that are treated, and these columns exfoliate off, and it results in this awesome glow of your skin. So here is someone who we call a type 1 skin type, meaning she's extremely fair. So this is kind of like the worst downtime that you would see in someone. So you see the second picture right afterwards, she's pretty puffy and she's red. And then by hour 18, she's already pretty much like her friends wouldn't really notice that she got anything done. And by 9 days, you're seeing that glow demonstrated. So I think this is a great treatment. And like I said, if you are darker than this patient, you're going to have even less downtime in general. Okay, so here's some pictures. Keep in mind with Clear and Brilliant, a lot of people, I do recommend getting more than one treatment, but I do say one treatment is better than doing nothing. So you can see she's only had Clear and Brilliant. She had 6 treatments, but look at the improvement in her brown spots. Look at her texture. Look at those forehead lines. They're better. No Botox there. I mean, her skin just kind of glows in the after picture, and that's a very typical result. So again, 6 treatments. You can see evening out of the skin. You can see the health of the skin coming through. Look at that. Like, this is hard to quantify, but look at that glow of her skin. Even if you look at her eyelid looks a little lifted, and that's because the skin tightens and pulls the eyelid up. So she is just looking awesome. And again, 1 week post 6 treatments. Look at that beautiful improvement of her brown spots. The health of her skin is just shining through. She has melasma, especially up here, but her cheek discoloration is also melasma. And that's one thing I forgot to mention. This is my favorite treatment for melasma. I think the PRX that I just talked about will help. This and Fraxel are my favorite treatments. And I prefer this over Fraxel because it's less hot. Heat will make melasma worse. It'll exacerbate the melasma potentially. So this is a very safe treatment to do. And I'm just thinking about this patient. I don't think her photos are in here, but I want to share them with you. She has life-changing results due to lots of Clear and Brilliant treatments. She's had probably over 6, but her results are just dramatic. Yes, melasma, I'm going to type it in the comments. It's this uneven discoloration, and it's extremely common. It's made worse by heat, sunlight, hormones, and genetics. And of course, in Arizona, it runs rampant because we have a lot of heat and sunlight. And like you saw in the photo, I have it myself very badly at times, but when I just had the Fraxel done and I have nothing right now for the melasma. Okay, but moving on, this is someone who does not have melasma. She just had a bunch of sunspots, and you can see how much better she is. Look at her forehead lines. They're greatly softened just by doing this treatment. Look at her overall skin texture. It looks healthier. It looks just more youthful. Finally, the last treatment of the day is Soft Wave. So if you attend these webinars, you have heard us talk about Soft Wave in the last 9 months. We've had this device for approximately 9 months. It is one of our favorite devices. Why? Because we get more lift than these previous 2 treatments I've been talking about. So with Soft Wave, we're actually going to see a lift in the eyebrows, a lift in the cheeks, help with the jowls, more dramatically than a lot of these minimally invasive or non-invasive treatments. Why? Because this is using ultrasound as an energy source. So the ultrasound is going to skip the top layer of the skin. It goes to the middle layer of the skin, heats the skin, and that heat produces new collagen, new elastin, and then some of that heat will diffuse down to the connective tissue that will help to lift. And when you lift, you really lift everything because everything on the skin of the face is connected. So if you lift your eyebrows, sometimes you can even just see your cheeks come up too, because everything's connected by that connective tissue. So this device is completely non-invasive. There are no needles. So just like the peel, there are just no needles, but this is an energy device. And what's great about this, there's 0 downtime. And also, you immediately look better. Again, you have a 2-week honeymoon phase where you're looking better right away. It's pretty amazing, actually. It's one of my favorite things. And again, that relaxes after 2 weeks, but then you get that collagen rejuvenation. So it's FDA approved for the eyebrows, the neck, this area, and the cheeks. So you will hear us talking a lot about that, but we use it for other things. Oh, and it was actually just FDA approved for acne scars too. And so far we've been very impressed with acne scar treatment as well. And that indicates a very robust response to collagen. So anytime you can fill in acne scars with the treatment, it's going to be really powerful in producing collagen. Excuse me a second. Hmm, excuse me. So here's my personal journey with it. So you can see the day of treatment. That was actually me in New York testing this treatment out at one of my friend's office. And then 2 weeks afterwards, I had, so that was actually about a year ago. 2 weeks afterwards, I just happened to snap that picture. And then 4 months after the first treatment, I was ready for another treatment, did the treatment. And then this final picture is 2 months after the second treatment. So you can see there's a gradual lift that's occurring and just a more youthful look. So if you look on the far left, you can see how my cheeks are pretty flat. There's not a lot of fat there to support the cheeks. Some of the tendons have, kind of gotten looser over time. So everything's kind of lifted as I've had these two treatments. And I actually just had Maya, our nurse injector and treater, actually do my forehead before she did the Fraxel last 2 weeks ago. So I've actually had a third treatment on my forehead to get some further lift. This treatment is a little bit more involved. We give you laughing gas, and you can feel some heat. At this point in time, 9 months in, we have some very effective tips and tricks to make this treatment more comfortable. And I recommend a 2-treatment protocol. So 1 treatment and then 3 or 4 months later doing your second treatment. If you choose to maintain with this treatment, 1 year after that. Excuse me. So here is an example of what you can see right after treatment. You see there's no redness, no downtime. She just looks better. Even though this patient's very young, you see the lift she got underneath her chin in that turkey neck area. And that's something that got better over time. So it's pretty cool. Here's a very young patient. You notice these patients, they're all staff members because when we had the treatment, I really wanted to see, or when we had the device, I really wanted to see what it could do. So a lot of these patients will be staff members who are, already very young and beautiful. But you can see this patient, there's been no weight change. You can see the lift in her cheeks and see how she just looks less heavy. That's because she had lift in her cheeks. And you can see the definition of her cheeks and it looks completely natural. Excuse me. Same patient, 3 months after her first treatment. So again, you can see how the cheeks have elevated in the lower face and it makes her look more feminine and more youthful. And her face looks less heavy. Here is a wonderful patient in her 40s. And again, after 1 treatment, she got a wonderful lift this is 3 months after her first treatment, wonderful lift in this turkey neck area. No weight change here. I made this patient weigh herself just to make sure. Look how much slimmer, more youthful, and more feminine she looks. And that's just after 1 treatment. And I wanted to put in these 3-month follow-up photos so you can see these results are sustained even after the initial treatment. Here's a patient who also got a beautiful cheek lift. This is 3 months after 1 treatment. Nothing else was done except for routine Botox in this area. So this is just a fantastic result. So that is it with the presentation. For the raffle, we are raffling off something called Upneek. It's an eye drop that will actually make your eyes bigger. So it is a drop you put in. It's in artificial tears. So the active ingredient is in artificial tears and is preservative free, so very safe to use. And it stimulates temporarily the muscles that are responsible for our eyes, the upper eyelid, I should say, actually. And that will make us look more alert. And so in my opinion, they're a little pricey to be using every day, but I use it on weekends, if we're going out to an event, or if I was going to a wedding, I would put some in. If I'm traveling for conferences and I don't get very much sleep because of time zone issues, I'll take some along and put some in. They're extremely useful, extremely safe. And I love, love, love this treatment. So one of you guys will get a box of Upneek. And there's 30 packets in there, so enough for 30 times. So here are your promos. So these promos are good for today only. I'm hoping some of you are going to treat yourself in the holiday season. You notice all of these things are very minimal or no downtime. So it's the perfect time of year to get something like this done. So for the PRX biostimulator, the PRX peel, 6 treatments scheduled 1 week apart. We're going to be a little lenient with that. But anyway, the company recommends doing the treatments 1 week apart. You're going to get a box of that Upneek that I just spoke about. So that will make you immediately look more alert. So again, super amazing during holiday season. If you have a party to go to, if you want to look great for pictures, etc. And then you will get the Skin Medica TNS Advanced Plus Serum. So I love, love, love this product. If I had to have one product, I would use the TNS Advanced Serum. It has growth factors and antioxidants in it to keep your skin super healthy and glowy. You can see most patients could see a result 2 weeks after using it, which is pretty fantastic, considering cell turnover is usually 30 days. So anyway, it's a great product. So you are going to get that for $1,700. The value is $2,045, and you are saving $345. We have 10 of these available, and we will work with you if you have a certain time frame that you want to get scheduled. And also, if you can't do the 1 week apart, we didn't understand, and we can be more flexible with that. The second promo is Clear and Brilliant. So we went with 6 Clear and Brilliant treatments, scheduled as soon as 1 month apart. You can, again, go a little bit further apart, but we want to get these treatments all done within a year. So it's not like 10 years from now and you're still taking advantage of this promo. 1 box of Upneek, the eye drops, and then the Skin Medica TNS Advanced Serum. So that promo is $2,950. The value is $3,545. And so you save almost $600. And we just have 10 of those available. Because we have limited time basically to do these for you, but super excited, hoping you'll take advantage of these. And then finally, the Soft Wave. So the Soft Wave is kind of, you're going to notice it's the most expensive, but it's also, if you just wanted to go for it, get the most bang for your buck, that's probably what I would recommend, would be the Soft Wave, because I think out of the 3 treatments, it's way more powerful than the other 2, at least for underneath the skin. One thing I should say as a differentiator, because the Soft Wave promotes collagen and elastin, you will get the youthful glow. You will get the skin like looking bright and dewy and super youthful, but it does not do any resurfacing. So it's all the magic's underneath the skin. So you will not get improvement in brown spots. And so if you have brown spots, I would recommend the Clear and Brilliant. If you have a little bit of brown spots and you want to start, maybe you haven't done anything for yourself for a while, maybe you want to start with the PRX, just because it's like something very easy to start with and you can be in and out. It's kind of a no-brainer. Maybe start there. If you really want to see the improvement, the lift you get with the Soft Wave, I describe it as subtle yet impactful. So you will look like yourself, but you will feel, in my opinion, you will feel really great about how you look. It's really been a game changer for me, personally. So anyhow, going back to the promo. Softwave promo, 2 full face and neck treatments. So we're going all in here. So we're going to do the full face. We're going to lift your brows. We're going to lift your cheeks. We're going to do a lip lift. And by the way, we posted a lip lift on social media the other day, and apparently it was a big hit. It's being reposted all over the world, actually. I saw a British post this morning and I'm like, oh, that's actually our post. So check it out on social media if you want to see an example of the lip lift. So you get all those things, and then they're going to do your neck too. So either my estheticians or my nurse will do your neck. And again, super amazing game changer. I'm a huge fan of this technology. It's so easy. There's no restrictions. I don't care about how much sun you're getting. I don't care if you have a big workout planned afterwards. You can go to a party afterwards. There's 0 downtime or restrictions. So that is $6,000. Again, it's the most expensive thing. The value, the value is $7,545. So you're saving almost $1,550. It's a great deal. I strongly recommend you take advantage of one of these things for yourself this season. I just want to say, I'm looking in the comments, and I just want to say that all these things, when you're talking about collagen, all these things are the longest lasting thing you can do for your skin. So this is the closest to permanent you're going to get outside of surgery. I hate saying permanent in aesthetics because we are aging at the same time. We don't have anything that stops aging, of course. And surgery isn't even, permanent, but that's going to be the closest thing you get to permanent, I guess. But with collagen will last years and years. The half-life of collagen, I think, is, I should look this up, but around 12 years. So you are going to get these long-lasting results. This is not something that wears off, like Botox wears off after 3 or 4 months. Filler wears off after 1 to 2 years, etc. This is something long-lasting that you're doing for yourself. It's not like you're wearing off. It's just that you continue to age at the same time. So in my opinion, if you do something like PRX, you're improving your skin. And what I've seen in clinical practice is people who do these things periodically, even if they're not, being consistent is always the best way, but even if they're not super consistent, if they have done something to lay a foundation, they're going to get better results the next time they want to do something. So you basically are setting a good foundation when you renew your collagen, and you continue to build on that every time you do something. And so again, in order of strength, I would say PRX is the last sort of dramatic result, but it also is real. It's there. I love that treatment myself. Like I said, I'm always trying to talk the estheticians into doing it for me. Clear and Brilliant. Yes, it absolutely works. It's so great for texture, melasma, brown spots, overall just tightening. And then if you really want the lift, so someone asks what is best for older skin. So if you don't have pigment that you're worried about, or pigment's lower on your list and you want to see more lift, I would do the soft wave. So hopefully that helps you kind of distinguish between these two. And if you've been thinking about doing something, hopefully the promos will help make it easier for you to do this. One more question I'm seeing. Can you use these treatments with fillers? You absolutely can. So oftentimes we're doing them same day. The order depends on the treatment. For instance, with PRX, I do the filler first, then the peel. Clear and Brilliant, same thing. Filler first, then the peel. Soft wave, the opposite. We're going to do the soft wave, then we can do the filler. So we can absolutely do these. We can do them same day. We can do them before or after. So super amazing to combine with other modalities. And whenever you do combination treatments, you always get a better result. So on that note, Maya, our nurse, is going to do a Clear and Brilliant example on one of our staff members. I'd love to see you observe it. If you want to hop off, that's absolutely okay. You'll still be entered in the raffle. I just have to answer this one last question because it's such a good question. Can you do a third treatment of soft wave 3 months after the second one? Yes, you absolutely can. So we usually wait, the company says wait 45 days. We usually wait at least 8 weeks. Usually 3 months is kind of what I prefer to do for anything collagen stimulating, 8 to 12 weeks. And then I have had 3 or 4 treatments, particularly on my forehead. Um, I think I've had 2 treatments on my neck. So you can keep going with the treatments. Um, that's absolutely not a problem. When I put in the maintenance once a year, I'm usually just thinking about budget and time. But if you are loving this treatment, you can absolutely do it more, and we'll help to guide you with the timing. So thank you for all those wonderful questions. We're going to pause for a moment, and when we come back, we will do this clear and brilliant treatment, and I'll answer more questions as as Maya's treating. But put it on the, is it? Hi, guys. Again, we're improvising because we're having some technical difficulties. Okay, so here's Maya treating Lauren, who works at the front office. And Lauren, have you ever had a cosmetic treatment before?
I've had an IPL done before.
Okay, so she's had an IPL done, and is that it? That's it. You seem to be doing okay.
It doesn't feel too bad.
Okay, amazing. So you can see it very easy. It's gonna go very quickly. Um, how would you say it compares to the IPL?
Definitely a lot less painful than IPL.
Amazing. Okay, that's fabulous. And so many people think IPL is no big deal. And then also they just told me that Hannah had a treatment earlier today. So I'm gonna bring her over here. You can take a look at her.
Hello.
This is
Hi.
Hannah. She just had a treatment like literally how many hours ago? Like
1 hour ago.
1 hour ago. And look at her. Obviously, she's still working. And I had no idea. They just told me that. So you can't even tell, especially if someone's it's not on their radar that they are, that they've had a treatment done.
Very
So-
minimal redness and no pain. It's very good treatment.
And how do you feel now? Like you feel like hot or?
No, I feel it's slightly warm. It feels like how they say it feels like a sunburn. That's exactly what it feels like. But you have that really nice glow afterwards. You're not peeling, you're not any tenderness, very, very minimal, no swelling. It's very good treatment.
Fantastic, thank
Thank
you.
you.
Okay, so I'm gonna look at some questions. How do you purchase one of the promos? I love that question. So I think Marcos is gonna send out an email okay, he's gonna send an email right afterwards. Can they purchase from the webinar? Don't you usually like?
We can, they can have a link for it.
Okay, so there's either gonna be a link that pops up or you're gonna purchase just right from the email that we send right after this, or call us. You can call our main number or you can call our cosmetic number, which is 480 651
4989.
4989. Call us. We have somebody there just waiting to answer questions, or if you want to commit to it. We are doing this just only through today because of our holiday hours and holiday season. And this is just such a great opportunity to do something for yourself. Anybody have any other questions? Let's see. Would threading or soft wave be more effective, and what is the difference? So I have done threading for years. I actually just love soft wave. I feel like it's way more predictable. The threads can be a little bit uncomfortable. So I think soft wave wins in terms of like comfort, predictability, and there's less side effects with the soft wave. Sometimes those threads will want to spit out or they'll shift. And then also there's 2 weeks after the threads where I ask you not to exercise, which is a kind of a huge deal for people, most people. And you're a little bit sore afterwards. And for some patients, that's like a day or two. For others, it can be a couple of weeks of soreness. So I prefer soft wave because of those reasons. When you do soft wave, do you recommend taking a couple of over-the-counter medications beforehand to help? Could you remind me what those medications are? Yes. Okay. So at this point in our practice journey, we are recommending that you pre-medicate with Tylenol and ibuprofen, your normal doses that are medically appropriate to you. So if it was me, I'd probably take one extra strength Tylenol and like maybe 400 milligrams of ibuprofen with like a lot of water. And then also you can talk to us if you're super sensitive. We can also do gabapentin, which is a nerve pill. Most of the discomfort from the soft wave comes from actually some nervy type pain. So if you take a gabapentin, it makes you sleepy, and then it also will help with some of the nerve discomfort. And then we do the Pronox too. So the Pronox will make you just more relaxed and makes you not care about any discomfort as much as you would normally. So great question. Anybody else have any questions? Great. All right, how's it feeling, Lauren? She just did your lip. That's
Yeah.
usually a pretty sensitive area.
I was warned about that, but I don't feel anything.
She doesn't feel anything. She's amazing. All right, great. Well, thanks you guys for attending. Happy holidays. I hope everyone has a wonderful, safe, and healthy holiday season. And thank you so much for attending these webinars. It really means so much to me in the practice.